Hello, class. Today we will be discussing the anatomical um, regions of the gluteus and the thigh. At any point during this lecture, please feel free to pause the video and review material to ensure that knowledge is solidified. Feel confident in going backwards and making sure that you have a firm understanding before advancing if that is necessary. So the gluteal region, which is often referred to as the buttocks, is a complex and fascinating area of the human body, particularly from an anatomical and functional perspective. This region is not only functionally integral for movement and stability at the hip joint, but also plays a vital role in overall posture and locomotion. Its intricate anatomy, including the muscular composition, nerve and blood supply, and its relation with neighboring structures, makes it a particularly interesting area of study in athletics, human anatomy, and clinically. Regarding the role in movement, the muscles of the gluteal region primarily act on the hip joint, producing movements such as extension posteriorly in the sagittal plane, abduction away from the midline in the frontal plane, lateral and medial rotation away and toward the midline in the transverse axial plane, respectively. However, before discussing specific muscles, it is going to be clear and necessary for us to understand the composition of the hip joint and its basic features. The osteological foundation of the hip joint includes the two os coxae, which are joined anteriorly by the pubic symphysis and posteriorly by the sacrum. It goes without saying that the femur is integral to the hip joint as well. Each os coxae is composed of three fused bones, those being the ilium, the pubis, and the ischium. The bones of the gluteal region contain foramina and notches that form into foramina with the help of ligaments. These foramina serve as conduits for muscles, nerves, and blood vessels that travel between the pelvis, the gluteal region, perineum, and the lower limb. Muscles of the gluteal region primarily act on the hip. These foramina include the obturator foramen, the greater and the lesser sciatic foramina, which are formed by these greater and lesser sciatic notches. These two foramina are partially formed also by the sacrospinous ligament, visualized here, which originates on the ischial spine and attaches to the lateral, sacrum, and coccyx to oppose the nutation of the sacrum during weight bearing and gait. Also, the sacrotuberous ligament originates from the ischial tuberosity and attaches to the lateral sacrum and coccyx to stabilize the sacroiliac joint. The hip joint is a synovial ball and socket joint. The ball is the head of the femur, and the socket is the acetabulum, a cup-like depression in the lateral os coxae. The head of the femur, specifically at the fovea capitis, visualized here, is very loosely tethered to the acetabulum by the ligamentum teres. This ligament courses deep to the transverse acetabular ligament to attach to the acetabular notch. The ligament of the head of the femur, or ligamentum teres, does not appear to play a major role in stability of the hip joint, but rather serves as a conduit for the secondary arterial supply to the head of the femur from the obturator artery. The acetabular labrum is a wedge-shaped fibrocartilaginous ring around the periphery of the acetabulum, which increases stability by deepening the socket and increasing the concavity of the articulating surface at this joint. The wedge shape of the acetabular labrum also assists in maintaining contact of the acetabulum with the femoral head. The transverse acetabular ligament completes the circle of the acetabular labrum by spanning the acetabular notch and forming a foramen for the passage of the ligamentum teres. The hip joint capsule is strong and extends like a sleeve from the acetabulum to the base of the neck of the femur to support the joint. The joint capsule possesses circular fibers which form a ring around the neck of the femur called the zona orbicularis, which is located roughly in this region. The capsule contains 3 capsular ligaments. Anteriorly, the iliofemoral ligament is a fan-shaped ligament that resembles an inverted Y. The iliofemoral ligament extends from the anterior iliac spine and bifurcates to attach to the intertrochanteric line of the femur. Inferior and medial to the iliofemoral ligament is the pubofemoral ligament, which attaches from the anterior aspect of the pubic ramus and extends posteriorly to attach to the anterior surface of the intertrochanteric fossa. Posteriorly, the ischiofemoral ligament attaches from the superior acetabular rim and labrum to the inner surface of the greater trochanter of the femur. As seen in previous lectures, the muscles of the gluteal region can be broken down by their action on a joint, that being the hip joint. Starting off, the tensor fasciae lata is a muscle that arises from the anterior part of the outer lip of the iliac crest, the lateral aspect of the anterior superior iliac spine, and the upper part of the anterior border of the iliac wing. The tensor fasciae lata descends between and is attached to the 2 layers of the iliotibial tract, generally ending around the mid-thigh. The tensor fasciae lata acts to stabilize the knee during extension and also serves a role in abduction. The tensor fasciae lata is innervated by the superior gluteal nerve. The gluteus medius and minimus both originate from the outer surface of the ilium and insert onto the greater trochanter of the femur. Upon stimulation, these muscles abduct and medially rotate the hip joint. In medial rotation, the gluteus minimus and medius are fundamental in keeping the trunk in an upright position when the contralateral foot is raised during walking, thereby preventing hip drop. The gluteus maximus is a large, coarsely fibered, quadrilateral-shaped mass of muscle, which forms the prominence of the buttock and covers the ischial tuberosity. The gluteus maximus arises from the iliac wing, the iliac crest, and from the posterior surfaces of the sacrum and the coccyx. Its fibers descend downwards and laterally. The deeper fibers of the lower part of the muscle are inserted into the gluteal tuberosity. The superficial fibers and the upper deep part of the muscle end in the tendinous sheet of the iliotibial tract. The gluteus maximus is a powerful extender of the femur when the thigh muscles are flexed. It is innervated by the inferior gluteal nerve, which is derived from the ventral primary rami of L5, S1, and S2. There are 5 muscles that attach to the sacrum, coccyx, and ischial tuberosity that travel through the superior and inferior sciatic foramen to insert on the femur at the medial aspect of the greater trochanter and intertrochanteric crest. These muscles are referred to as the gluteal lateral rotators. Those muscles include the piriformis, the superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Based upon their location of these muscular insertions, they act to laterally rotate the femur at the hip. The lower limb receives sensory and motor innervation from the ventral primary rami of L1 to S4 via the lumbar plexus and the sacral plexus. The lumbar plexus originates from ventral rami of L1 to L4. It provides motor and sensory contributions to the anterior and medial compartments of the leg, as well as to the abdominal wall and pelvic areas. The sacral plexus, ventral primary rami, L4 to S4, innervates the posterior compartment of the thigh and the entire leg and foot. Most of the sacral plexus is divided into an anterior and posterior division. The anterior division provides the primary motor innervation to the posterior compartment of the thigh and leg. The posterior division provides the primary motor innervation to the anterior and lateral compartments of the leg. Another way to think of this is that the anterior branches supply flexor muscles of the lower limb, and the posterior branches supply the extensor and abductor muscles. The abdominal aortic artery provides blood supply to both lower limbs. At the level of the 4th lumbar vertebra, the abdominal aortic artery branches into a right and a left common iliac artery, which go into ipsilateral lower limbs. Each iliac artery bifurcates into an external and an internal iliac artery. The internal iliac artery gives rise to the obturator artery and to the superior inferior gluteal arteries. Its branches primarily supply blood to the pelvic and gluteal regions, whereas the external iliac artery supplies blood to the remainder of the lower limbs. Blood is returned to the heart via the superficial and deep venous systems of the lower limb. Within the gluteal region, unique relationships occur between the muscles, nerves, arteries, and veins. Specifically, the superior gluteal nerve, artery, and vein, visualized here, enter the gluteal region superior to the piriformis muscle and inferior to the gluteus minimus. The remainder of the nerves of the sciatic plexus, the sciatic nerve, and the inferior gluteal artery and vein enter the gluteal region inferior to the piriformis muscle. It should be noted that the pudendal nerve moves deep to the sacrotuberous ligament, where it may get entrapped over the sacrospinous ligament, which would lead to chronic pain in the gluteal and the perineal region. The human thigh is a compelling and a complex area of study in anatomy, embodying both intricate structures and essential functions. The thigh's notable relationships with the hip and knee joints make it a fascinating and vital area of study in human anatomy. Understanding the thigh's role in movement and stability is crucial for comprehending overall body mechanics and function. As mentioned, the thigh has mechanics that are able to move the ball and socket joint of the hip in various planes and directions, particularly in posterior extension, anterior flexion, abduction towards the midline, adduction towards the midline, and medial rotation. Similar to the arm and the upper limb, the thigh also works at a distal joint, that being the knee. Here, the muscles of the thigh serve to flex the knee posteriorly and extend the knee anteriorly, and to both laterally and medially rotate the lower portion of the lower limb, called the leg, at the knee. It should be noted that the movements of flexion and extension are in opposite directions at the hip and at the knee joints. The muscles of the thigh that allow for such movements are divided into fascial compartments, those being an anterior, a posterior, and a medial compartment, which are separated by 3 intermuscular septa. The lateral, posterior, and medial intermuscular septa, which are visualized here. These septae are tough fibrous sheets that meet superficially to form the fascia lata medially and the iliotibial tract, or the IT band, laterally. The fascia lata and IT tract surround and encase the muscles of the thigh into a tight bag that runs from the pelvis down to the knee. The muscles in the anterior compartment of the thigh are primarily flexors of the hip and extensors of the knee because of their anterior orientation. The femoral nerve, originating from ventral primary rami L2 through L4, innervates these muscles. However, each muscle does not necessarily receive innervation from each spinal nerve level between L2 and L4. The muscles include the iliopsoas, arising from the psoas major, and the iliacus, and inserting onto the lesser trochanter of the femur. The sartorius muscle, which moves inferior and medially to insert onto the pes anserinus over the tibial tuberosity. Lastly, the quadriceps femoris muscle group includes the rectus femoris, the vastus lateralis, vastus medialis, and vastus intermedius. All act to extend the knee due to their united insertion onto the patella. The muscles in the medial compartment of the thigh are primarily adductors of the hip because of their medial origin and lateral insertion, which pulls the femur medially when these muscles are flexed. These muscles include the obturator externus, pectineus, the adductors magnus, brevis, and longus, and lastly, the gracilis muscle, which is located medially. The obturator nerve from ventral primary rami L2 through L4 innervates most of the muscles in the medial compartment of the thigh, except the pectineus, which is innervated by the femoral nerve, and the ischiocondylar or hamstring division of the adductor magnus, which is innervated by both the obturator and the tibial nerve. The muscles in the posterior compartment of the thigh are primarily extensors of the hip and flexors of the knee because of their posterior orientation. The tibial nerve from ventral primary rami L4 to S3 innervates the muscles in the posterior compartment of the thigh, with the exception of the short head of the biceps femoris, which is innervated by the common fibular nerve. Muscles in this posterior compartment include the semitendinosus, the biceps femoris, which has a short head and a long head, and the semimembranosus. Muscles of the thigh are innervated by fibers originating in both the lumbar and the sacral plexus. The femoral nerve emerges as the largest branch of the lumbar plexus, deep to the lateral border of the psoas major muscle, and passes deep to the inguinal ligament. The femoral nerve then enters the anterior compartment of the thigh, where it provides motor innervation to the quadriceps femoris muscle groups, the sartorius and pectineus muscles. In addition, the femoral nerve provides sensory innervation via the anterior cutaneous nerve of the thigh and the saphenous nerve. The obturator nerve from L2 through L4, ventral primary rami, emerges from the medial border of the psoas major muscle, passing posterior to the common iliac artery, and enters the medial compartment of the thigh through the obturator foramen. The obturator nerve provides motor innervation to the medial compartment of the thigh, excluding the pectineus and hamstring portion of the adductor magnus muscle. In addition, the obturator nerve provides sensory innervation to the medial region of the thigh. The blood supply to the lower extremity is from the common iliac artery. The common iliac arteries divide into the external and the internal iliac arteries. The external iliac artery passes deep to the inguinal ligament to become the femoral artery, serving as the primary blood supply to the lower limb. The internal iliac artery gives rise to the obturator artery, which also contributes to blood supply of the lower limb. The femoral artery gives rise to the profunda femoris, which is visualized here. The profunda femoris is the largest branch of the femoral artery and is also called the deep femoral artery. It arises posteriorly in the femoral triangle and travels between the adductor longus and brevis muscles and the adductor longus and magnus muscles. The profunda femoris is the main contributor of blood to the posterior and the medial compartment of the thigh. Superior in the thigh, the femoral artery also gives rise to the medial and lateral femoral circumflex arteries. The lateral circumflex artery provides three notable branches, those being the ascending, transverse, and descending branches. The main trunk of the femoral artery supplies the anterior compartment of the thigh before traveling through the adductor hiatus into the popliteal fossa to become the popliteal artery. Lastly, the femoral triangle is an anatomical space located in the inguinal region and contains the femoral nerve, artery, vein, and lymphatics. Often, these contents are memorized by the mnemonic navel when listing the contents lateral to medial. The boundaries of the femoral triangle include the sartorius muscle laterally, the adductor longus muscle medially, and the inguinal ligament superiorly. The first letter in the name of each boundary uniquely spells out the acronym SAIL. As the femoral artery, femoral vein, and associated lymphatic structures course from the abdominal cavity into the femoral triangle, the transversalis fascia forms a connective tissue sheath around each vessel, which is called the femoral sheath. However, the femoral nerve is lateral to and not contained within the femoral sheath. The fascia lata forms the roof of the femoral triangle with an opening similar to a skylight called the saphenous opening. This opening permits the greater saphenous vein of the lower limb to pass as an arch to join the femoral vein within the medial region of the femoral triangle. The deep inguinal lymph nodes include 1 to 3 nodes that are located medial to the femoral vein. These lymph nodes receive lymph from deep lymphatic vessels associated with the femoral vessels and glands of the penis or clitoris. Also, the deep inguinal nodes drain into external iliac nodes. With that, This completes our discussion of the gluteal region and structures of the human thigh.